welcome back to my channel. So today, we're gonna talk about gender disparities in mental health. So what are we waiting for? Let's start this topic. We observe various mental health cases in today's generation. Most of it boils down to serious violation of their rights, and that includes their sexual rights, especially for women. In addition to this, men have higher suicide rates compared to women, but women have the most suicide attempts. In my point of view, women have the higher risk of having mental health problems since they are more inclined to their emotions, while men are being affected mentally due to drug abuse. As it is mentioned in the article, men have higher suicide rates, maybe because they are more decisive and affirmative in their decision, while women have countless attempts since they're possibly having second thoughts about doing it and are scared of what might happen. As I've read this section, I've realized that comorbidities are associated with depression, whereas women predominate with these depressive disorders or panic attacks, and that is the reason why they are more prevalent in this manner compared to men. I definitely agree with this statement. People who are associated with mental health problems should be knowledgeable enough in their respective fields to be an efficient tool to control or to lessen these comorbidities and mental health problems, depressions, panic attacks. Psychologists, psychiatrists, and even researchers who studies about mental health problems, disorders, depressions, and panic attacks should have a sufficient knowledge to address these different problems in their own particular way. With this being said, we can see the gender bias that society has imposed to each and every one of us. And this is definitely one example of stereotyping. Men does not have the courage to disclose their mental health issues, depressions, anxiety, panic attacks to specialists due to these gender biases that society has imposed to us. And this only worsens the situation because these men who are experiencing depressions or panic attacks are being prone to alcohol use or substance use, while women, on the other hand, are being prone emotionally to their problem. And with this being said, aspects that affect both genders' mental health is associated with gender inequality and discrimination, which makes them suffer mentally. Depression may be caused by these factors: seeing self in an unwanted position, behaving in a passive way, and experiencing a sense of defeat. One example of this is when a woman initiates a breakup. When a woman initiates a breakup, only few of them, or only 10% of them, are being affected by it and are being depressed about it. But when a man initiated a breakup, most women have the possibility to be depressed. read this section entirely. I've analyzed it thoroughly, and depression in the workplace is mostly caused by skills, and decision-making authority. Depression in the lowest employment grade is much evident compared to the higher ones, maybe because they have the higher possibilities of personal life challenges and low salaries. Women and men's mental health status cannot be defined by this gender. We should also consider, of course, their status in life or their emotional well-being. For example, women that have low incomes or if they are alone in the household have the higher risk of having depression. Furthermore, women who are exposed to dangerous surroundings like poor women or in the lower class may experience high levels of depression since life isn't easy for them due to these surroundings and also discrimination by the society. As I've analyzed this section, economic policies can also affect our mental health because of the sudden changes in these policies that may affect our way of living. And with this being said, most people would probably be depressed. Based on what the article says, depression particularly happens when a severe occurrence happened. The occurrence of these events may be worsened when accompanied with a person's difficulties like personal problems, challenges in life, and so on. So to sum up this section, a strong connection exists between the occurrence of events and the predominance of depression. Violence in particular is also one of the main reasons why women acquire depression. Violence may cause women to lose their jobs, that results to loss of income as well. With this being said, the trauma that the violence may bring to women may cause anxiety attacks, PTSDs, post-traumatic stress disorder, and depression. Implication for policies should be efficient and effective to create a much better environment with less people having depressions and disorders. Budgets for mental health should be focused on to find a way of treatment and care for these patients. All healthcare members should also be knowledgeable in their field and well trained for them to handle these patients in the best way possible and counsel them effectively. To sum everything up, various factors affects both genders. Mental health may be their social status, occurrence of events, low income, violence, and many more. But regardless of the factors that were mentioned, mental health should be focused on and should not be disregarded. The government and anyone involved in mental health aspects should improve their ways and research more on the treatment that the patients must acquire in order to be better. So that's all, guys. Thank you for listening.